In a recent interview at Loma Linda University Children's Hospital, we spoke with cardiologist Dr. Leonard Bailey, who in 1984 performed the first pediatric heart transplant on baby Faye at Loma Linda Hospital. Here now is Dr. Bailey with this remarkable story.
We had this protocol that the review board had approved that would allow us to put a selected infant baboon heart into the first recipient, baby Faye. That heart performed without a glitch in the first few days after transplantation. And then at about day 9 or 10, there was a glitch in the care at the bedside. We were giving a drug called cyclosporin A in those days. Unfortunately, the full syringe of this concoction managed to get in the baby in just a matter of a few moments on that particular day. It was discovered right away, and the baby's immunologist and I decided that the first thing we should do is an exchange transfusions. And we reported all this in the JAMA article on the baby. And things went along reasonably well, probably because we did an exchange transfusion for another 8 or 9 days. And then the baby began to have some changes that we couldn't understand. It was like nothing we had encountered in the laboratory. It certainly didn't represent rejection of the heart graft. It was something entirely new and different. And then she began to be a little blue and had to be put back on a ventilator. And she had this cyanosis that was inexplicable as well. And finally, the last thing that sort of phased out was her little heart. On about the 20th or 21st day or so after surgery, we started some medicine to sort of cheer the heart up if we could, but it was clear that the heart was going the same way as these other organs. And it was such a mystery. And we knew then that we were in trouble here and we were probably going to lose the baby. And that happened. And we spent months after that with autopsy specimens trying to sort out what really happened to baby Faye. The evidence suggests that there was not rejection. She didn't have immunoglobulin in this heart. She didn't have any cells invading the heart. But she did have little infarcts in the heart. Infarcts meaning that the blood supply to some areas of the lungs, brain, kidneys, heart, the blood supply was jammed up somehow so that the muscle beyond or the lung beyond simply died. The major lesson from baby Faye is that that combination of donor and recipient is feasible. And about a year later, we had a phone call from Northern California that there was a baby who was brain dead. The parents desperately wanted to donate organs. Nobody was interested. Are you in the transplant business at Loma Linda? And I said I thought we were. Let me go see if there's a baby here that may be dying of the same heart disease baby Faye had. And sure enough, there was. And so baby Faye's experience really led straight to the first successful newborn heart transplant. That sort of started the infant transplant industry. And it was the major growth area in all of heart transplantation for a number of years. It escalated the total numbers right on up to about 500, 550 worldwide annually. There have now been something in the order of 11 to 12,000 infants and youngsters transplanted, largely as a result of the impetus from baby Faye. So I think her legacy has been phenomenal.